Good morning, everyone. Thank you for being with us this morning. I'm Delano Manson, Chief Executive Officer for the Kentucky Nurses Association, the Kentucky Nurses Foundation, and the Kentucky Nurses Action Coalition. Before we start our program, a few things to note. We will take your questions via the chat box after our presentations. And if you would put your name and the organization that you represent in the chat box, that would be great. And if you will keep your mic on mute during the session, it will help us tremendously. The Kentucky Nurses Association is the voice for 88,000 nurses in the state of Kentucky, no matter where they work or what they do. The nurses have been recognized by the Gallup poll for 19 years straight as the most trusted profession. And we make up 53.3% of the healthcare workforce. I've been a nurse for more than 40 years, and I have never experienced what is happening to us right now during this pandemic of COVID-19. Nurses in the state of Kentucky are soldiering on. They're showing up every day. They're exhausted. They're tired. But they keep showing up. They're nurses. That's what they do. That's what we do. It's how we roll. To find out what's most important to nurses regarding work safety, emotional health, physical health, and professional stability, the Kentucky Nurses Association surveyed more than 70,000 nurses across the state. This morning, we will share those results with you, and we will also address the critical nursing shortage in the Commonwealth. Today, you will also hear from nurse leaders from various healthcare industries and from our regulatory agency about the issues they face surrounding the shortage. And we will cover practical solutions that need support from legislators and from you to support the nurses who care for us and those that we love. Now I'd like to turn the program over to Donna Metter, President and Chair of the Kentucky Nurses Association Board of Directors, to share a snapshot of the nurses survey. Some 850 nurses made their voices known. It's time that we listen. Donna?
Thank you, Delano. I'd like to thank you all for joining us today. Also, coverage from our media partners will help drive our message home to everyone in Kentucky. Now I'd like to share this recap of the Kentucky Nurses Survey with you. A survey instrument was created and launched by the Kentucky Nurses Association KNA on October 1st, 2021, and remained open for 2 weeks. The purpose of the survey was to identify what is currently most important to Kentucky nurses regarding work, safety, emotional health, physical health, and professional stability while confronting the challenges of the COVID-19 pandemic. A response was good to our survey and yielded a sample of 850 nurses. The sample was rich in experience, with most of the respondents, 61%, possessing 21 to more than 30 years of experience. Approximately 1/4 of the sample indicated it was likely that they would leave their current position in the next 3 months, while 3/4 were unsure or unlikely to leave soon. 25% of a population of 88,000 is a significant potential loss to the state of Kentucky of nurses. Respondents identified highly rated explanations with both financial and non-financial implications for the nursing profession. However, it is understood that many actions which could support the nursing workforce rely heavily on the availability of additional staff, which involve the availability and allocation of financial resources. Now we'll go to reasons for the shortage. Highly rated explanations with financial implications included insufficient nursing and support staff, and not enough pay or financial incentives as primary contributors to the nursing shortage in Kentucky. The top ranked contributors to the nursing shortage in Kentucky were the number one rated was lack of sufficient nursing staff or heavy patient loads, and that was 73% of our 850 respondents. Not enough pay was noted by 41% of that group. Physical exhaustion by 26% of the group. Fear of transmitting COVID to family or friends due to working as a nurse by 24% of our respondents. And then a tie for the 5th position is lack of support staff to alleviate non-nursing tasks and lack of support for nurses from management and administration for 22% of the respondents. Nurses offered the highly rated, not immediately financial explanations of exhaustion, lack of breaks from work, lack of support from management, and lack of voice or influence as contributors to the nursing shortage. Solutions. Nurses also identified financially supportive actions to alleviate the nursing shortage. More staff to alleviate heavy patient assignments, higher pay, non-clinical staff to offload non-essential nursing tasks, financial incentives, including student loan forgiveness. Nurses identified the following highly rated, not immediately financial supportive actions to help alleviate the nursing shortage, which included breaks from work, ability to influence decisions impacting nursing, ability to influence decisions impacting patient care, better communication pathways between nursing and management and administration, and solutions to address physical and verbal abuse from patients and family members. Here's what nurses in the study had to say about what could alleviate this current nursing crisis, and this was based on a Likert scale from 1 to 5. The top rating at 4.8 was more nursing staff to alleviate heavy patient assignments. Next, at 4.6 was higher pay. At 4.5 was adequate time away for lunch and work breaks. Also at 4.5 were more non-clinical staff to offload non-essential nursing tasks. And then next was the ability to influence decisions that directly impact nurses and the ability to influence decisions that directly impact patient care. Other noted areas of professional support included financial incentives such as profit sharing, better communication pathways between nursing staff and management and administration, student loan forgiveness, consistent availability of personal protective equipment, implementing effective solutions at work to address physical and verbal abuse from patients and or their family members, training on how to cope with death and other moral conflicts, crisis management staff training, how to manage stress and anxiety, and on-site counseling support. Some personal support areas that were noted were assistance with childcare, grocery shopping services to home, picking up medication, food delivered to home, and then some social and community report includes people would get vaccinated, that people would wear masks, and that neighbors, patients, families, and coworkers would treat them better. Opportunities exist to use the findings in this report to inform and address those contributors to the nursing shortage that can be influenced through the allocation of additional financial resources, such as, again, more nursing and support staff, higher pay, and financial incentives. Additionally, findings outlined in this report can be used as a foundation for meaningful dialogue with nurses working in all occupational settings throughout the state of Kentucky. Actions can be collectively designed in collaboration with all nurse leaders from the bedside to the boardroom to effectively address the financial and non-financial contributors to the nursing shortage identified in this study, such as innovative staffing solutions, consistent breaks from work, greater influence and voice, better communication with management, and actions to effectively address the verbal and physical abuse that is becoming more prevalent from patients and families. We also ask that you consider these facts about the nursing shortage. Pre-pandemic, so this nursing shortage in our state and across the nation existed before the pandemic began. According to findings from Georgetown University, supply and demand through 2020, 23% of nurses 55 and older plan to either leave nursing or reduce their volume of clinical work. More than 1 million baby boomers will retire over the next 2 decades, increasing the need to train new nurses to replace them. And the 2012 through 2024 Kentucky Occupational Outlook, unique to our state, that report projects the state will need an additional 16,047 nurses by 2024. This represents a 36% increase over estimates for 2014. An aging population is cited as one reason for the high demand. More than 727,000 Kentuckians have tested positive for COVID, with nearly 9,400 deaths, according to the Kentucky Department for Health. The vast majority of COVID patients that are pushing hospitals past the brink are unvaccinated. Available data shows that 1.1% of COVID hospitalizations are people who are fully vaccinated. The global pandemic has only worsened problems that have long existed within the nursing profession, in particular, widespread stress and burnout, health and safety issues, depression and work-related post-traumatic stress disorder, and even increased risk of suicide. We will include the full report with the news release that we will send out later today after this press conference. I'd like to turn the program now over to our first invited speaker, who is Kelly Jenkins, Kelly is the Executive Director of the Kentucky Board of Nursing. Kelly?
Good morning. So I'm just going to give a brief overview of where we are at the KBN as far as our licensure and what we do with the programs of nursing, and then some things that we have in emergency regulations to help support efforts for the pandemic. So first and foremost is our mission statement. Many people sometimes get confused with KNA versus KBN. So I just want to remind people that the Kentucky Board of Nursing exists to protect the public by development and enforcement of state laws governing the safe practice of nurses, dialysis technicians, and licensed certified professional midwives. Currently, here's where we are with our 2021, as of October 2021, with our total current license, we have 89,822. You can see our retired nurses has gone up a little bit since the beginning of this year. Another thing that I want to point out is the programs of nursing. We do regulate the programs of nursing, and so I know many times there are people that say that we have caps on our nursing programs. So I just kind of wanted to let you know that the program of nursing that desires to increase their enrollment beyond their enrollment baseline, they do submit a request to the board. However, the request is only necessary if the increase is greater than the following. So if the enrollment baseline is 50 or less, they can increase by 10 students. If their enrollment baseline is 51 to 100, they can increase by 20 students. Or if the enrollment baseline is greater than 100, they can increase by 25 students. Benchmarks that we look at the Board of Nursing whenever we're allowing is over a 3-year period. So we do take into consideration the schools, the program of nursing's pass rate. We look at faculty turnover rate, program administrator turnover rate, and of course their graduation rate. So those are just some things that we take into consideration when we have schools that are wanting to increase their enrollment. Currently, where we're at with the programs of nursing and empty seats. So this is another thing that I felt was important to point out is that this last year, so our annual reports are due in on October 15th. So this is 2020 data, not 2021 data. But for our BSN program, we had 385 empty seats. And for our associate degree programs, we had 296 empty seats. This just shows some statistics for the last 5 years with our programs of nursing and current enrolled in different nursing schools. So this is total. And you can see over the past 5 years, we have increased steadily. And this just breaks down our RN and practical nurse programs. So you can see from the last 5 years, we have still continue to increase the number of RNs that we are producing. This just gives a summary of the number of programs for pre-licensure RN programs in Kentucky. So you can still see that the ADN programs, we have 36 of those. This just gives a map and a location of the state of Kentucky as to where our schools of nursing are located. And there's actually a link I can share with you all as well, and it kind of gives you a breakdown of what types of schools and where they're located. So you can see, our concentration is in the central part of Kentucky. So, out on the far west, we still have a lack of nursing schools being provided in the far east and far west part of our Commonwealth. And then I wanted to speak about some of the emergency regulations that we still have in place. Currently, we are still not requiring a collaborative agreement for our APRNs. We still have an out-of-state registry. So that allows, in particular, Ohio and Illinois, it allows those people to cross over into Kentucky to provide care. And then we also still have the PCA registry, which has over like 700 of those right now, which I know greatly impacts our long-term care facilities. Another thing that just a reminder for the hospitals and healthcare providers that we also have a regulation regarding employment of nursing students. And I know this can really help provide care and give some support to the RNs that are out there working on the front lines. And basically remember that if the student has been checked off in competency and educationally prepared in their semester of schooling, then they can do those tasks as long as they've been checked off in the hospital setting or nursing home setting. So these last year nursing students can be a tremendous help and support to our frontline nurses. And the Board of Nursing also offers the Incentive Scholarship Fund. So $5 of your licensure renewal fee does go to this program. And this gives a breakdown of how many scholarships we award each year and the money that's associated out of that. So that's a great way to grow more nurses in Kentucky. Another thing that we will be doing, we've already started the process, but next year in 2022, when you renew your license, we will be adding some more mandatory questions to our license application so that we can get a better, clear picture and accurate data on our current status of our workforce in Kentucky, where they're working. Because many times we may have active license, but they may not be actually working in a nursing position. And that's all I have. Thank you, Donna.
Thank you very much, Kelly. We appreciate you joining us today and for your comments. Now I'd like to turn over our program to Kristin Pickerel. Kristin is the past president of the Kentucky Organization of Nurse Leaders, which is the Kentucky chapter of the American Organization for Nurse Leaders. She's also the director of critical care and emergency services at Norton Healthcare, and she's going to share her thoughts with us from the nurse leader perspective from KNA.
First, just wanted to give a brief overview of what the KONL is. Our key priorities and strategies that we try to implement for the Commonwealth of Kentucky. Our mission is to develop, support, and advocate for nurse leaders as they enhance the delivery of healthcare. Our vision is that we engage community of nurse leaders with one voice advancing the health of the Commonwealth. So our organization is made up of around 150 leaders throughout the Commonwealth in varying leadership positions. We have educators, we have nurse managers, we have chief nursing officers. So please check us out if you're interested and want to learn more about the KNL. So I'm going to give just a brief overview and an operational leader's perspective on things right now, because as you've heard from Donna and others, staffing is really at a critical point right now at most all hospitals. And what we're seeing is we are having to hire travel nurses to replace nurses that are leaving to go travel. So it's a vicious cycle that all of us in leadership are trying to figure out, how do we get out of this? So this is certainly a priority for us operational leaders throughout the state. For another piece of that is this is adding to the cost of care for all of us. So you think about salary and wages are your number one cost to any organization, and particularly hospitals. So it's really folding into budget discussions and what does 2022 look like. So we're really at a critical point right now with staffing and the cost of providing the care to patients that hospitals are really having to take a deep look at how do we get out of this vicious cycle. Another piece that has been a key point to hospitals and organizations is the amount of moral distress right now that we're having with our nursing staff. You know, we started this pandemic with nurses being heroes, and we were fed and brought food and signs went up, and it was really a really rallying point for the public and community to rally around us nurses to say thank you for everything you're doing. We are proud of you. Keep doing it. And it's really kind of morphed into something different at this point. We are experiencing, as Donna mentioned too, some violence against nurses in the hospitals. all because of the pandemic and one's beliefs that it's not real. And we've had instances where we've had upset patients and family members, and that's just been a very high level of distress for nurses to have that flip from hero to not at this point. And then another key component of this moral distress is our nurses have seen a lot of unnecessary suffering over these 18-19 months. And we know it's unnecessary, and it could have been prevented, particularly now because of the vaccine. So that is just really adding to that distress and burnout that our nurses are feeling at this point. And then last, I just want to make the comment around the nurses that graduated last year in 2020 and that are coming out of school now. Those poor nursing students, didn't get the clinical experience that probably all of us did, coming out of school and being, very prepared to jump into being a nurse. And it's been a lot of planning and a lot of remote learning and a lot of, hand-holding and getting nurses to the point that we need them to be to provide the care. So it's really kind of changed how we delivered that education and got nursing students up to par, up to the point that they feel comfortable and in providing safe care. So again, thank you for letting me speak. And if you have information, you want to obtain some information about the KNL, please feel free to reach out to me.
Thank you, Kristin. I'd now like to invite Betsy Johnson, President of the Kentucky Association of Health Care Facilities, Kentucky Center for Assisted Living, to share her comments with us. Betsy?
Thank you so much. And thanks to the Kentucky Nurses Association for organizing this today. It's exciting to see the attention that this press conference is getting. This is a very important issue. Nurses and nurse aides are the backbone of long-term care. We could not provide the services that our elders need without our nurse staff. And we are in a workforce crisis, as everybody's been explaining today. Workforce recruitment and retention of direct care staff has been a persistent challenge for years and is among the most pressing challenges confronting long-term care. Medicaid underfunding has left skilled nursing facilities struggling to compete for qualified, dedicated caregivers. The government controls how we're paid, and so it's very difficult for us to compete with other healthcare settings and other workforce settings. Our long-term care staff have dealt with exhaustion, childcare issues, getting sick with COVID-19, having to isolate, and becoming full-time caregivers for those in their own home. We need to emphasize the importance of nurses. Nurses have a rewarding career, and they are taking care of Kentucky's most vulnerable. In the long-term care setting, an individual could start out as a state registered nurse aide and then work their way up to an LPN or registered nurse, and then eventually become a directors of nursing. So long-term care is a career path, and we want to encourage those entering the nursing field to choose long-term care. The need for nurses will only grow as the baby boomer generation will double the elderly population by 2060. Everyone will eventually need some type of long-term care services, whether it's short-term rehab in a skilled nursing facility or longer services within that skilled nursing facilities. Without the nurses, these services cannot be provided. Our association has been working diligently on these workforce issues, and we fully support our government providing funding either through American Rescue Plan Act dollars or other means to provide loan forgiveness for those who choose nursing and long-term care, or more funding to deal with the long-term care recruitment and retention specifically. So again, I want to thank the Kentucky Nurses Association for listening to us. And we are thrilled to be working with both them and the Kentucky Board of Nursing on these important issues.
Thank you so much, Betsy. We appreciate your time this morning. Now we'll turn our attention to Deb Campbell, who is a KNA member and the Vice President of Quality and Health Professions for the Kentucky Hospital Association. She couldn't be with us today, but she has prepared some remarks for me to read. The Kentucky Hospital Association is grateful to the Kentucky Nurses Association for the deployment and analysis of this very important survey. The evident workforce shortage, particularly related to nurses, is a priority for all of our members, and so, of course, for us as well. KHA is looking forward to working with our partners to bring attention to this very complex issue at the state and national levels, to bring attention to this and to bring resources and creative strategies to bear so that nurses can better serve their patients, but also enjoy more healthy, satisfying work lives. And now another person who was not able to be here, but who has been part of our work group was Tim Vino. Tim is president of Leading Age, another long-term care association. He also shared some remarks that he would like for us to share with you all. Tim says, the nursing profession has been the lifeblood of our healthcare infrastructure since the founding of our state and even before. Nursing shortages have persisted in the past, and the challenges of the previous 19 months have taken an enormous toll on this vital infrastructure. A stable workforce continues to be a struggle for all long-term care facilities in the Commonwealth. Our members work diligently to recruit and keep talent, but the COVID-19 pandemic has made this even more difficult. Long-term care workers are fatigued and faced with the challenges that come with working with some of our most vulnerable citizens. We believe immediate investments would help improve Kentucky's long-term care workforce throughout the state and in turn provide the best possible care for Kentucky's most vulnerable citizens. Staffing levels among long-term care providers are at a crisis point. Members are struggling to provide sufficient staff and to cover available bed capacity. Funding is crucial to stabilize the long-term care safety net in Kentucky and invest in those who provide access to care for Kentucky's infirm, elderly, and disabled citizens. We also should be prepared to address future workforce needs as a part of this initiative. Leading Age Kentucky is proud to stand with the Kentucky Nurses Association as we work together to rebuild the nursing and healthcare workforce in our state. What is extremely important for everyone to hear is that the nursing shortage is not new and it will not resolve itself without a concerted effort of nurses being at the table where solutions are discussed and decisions are being made. Nurse leaders have been meeting to discuss and find solutions. Using the preliminary survey data, leaders identified financial and non-financial solutions. So some of these non-financial solutions include, as you see, nursing at the table to discuss solutions to the nursing shortage, including funding allocation, and creation of a task force of nursing leaders representing all corners of Kentucky and all major areas of nursing, for example, practice, education, research, advocacy, innovation, and technology to address the nursing shortage. Financial solutions include the Kentucky Nurses Association is recommending that $100 million be dedicated toward these financial solutions to improve the nursing shortage, beginning with $20 million to improve faculty retention, recruitment, and to reward for schools of nursing for NCLEX pass rates and graduation rates. Formation of a college and school of nursing council to research why schools of nursing seats are going unfilled. We also request a $20 million amount for loan forgiveness for nursing faculty, students, and graduate nurses to work in underserved areas from between 2021 through 2026. And then the Cabinet for Health and Family Services application for the loan forgiveness grant through HRSA, which would be a $1 million a year in addition to this request of KNAs. Next, we request $10 million to support a nurse emeritus program to utilize retired nurses for support, augment staffing needs, and retain novice nurses. We believe that a brain trust, a wealth of knowledge, is considering or has already retired earlier than they plan to retire due to the pandemic. And we could put that group back to work in a very capacity that would be worthwhile and doable for them to, again, provide that brain trust, that wealth of knowledge to our more younger nurses. And then a $50 million allocation would be worked toward retention bonuses, incremental, for nurses, local nurses only, those who are in Kentucky, including all of those who have stayed local, stayed in Kentucky, and worked to support their communities. And next, a recruitment and marketing campaign that enhances the image of nursing and entices students to go to nursing school while ensuring that our current nurses feel recognized and valued, sharing gratitude from the public. These recommendations are based on survey results and the polling of nurse leaders in the group that has been working to solve this problem. Delano?
At this time, we'll take questions from the audience and attempt to address them in the best possible way. Kelly, they would like your presentation from the KBN. I told them that we would make that available. And then we have Bria Jones from WFPL. She would appreciate the contact for the KBN communications person, as well as Kelly Jenkins. I think we can manage that. Does KBN see an opportunity to critically review colleges that have empty seats and partner bridge opportunities for colleges that have applicants that they cannot support and turn away due to space, faculty, clinical sites, so that we can keep Kentucky strong with those interested in nursing? Kelly, you want to take that one?
So this has been brought up in many of the meetings that I've been attending for workforce, Kentucky workforce initiatives. And so there was, I think one way is that we're going to have to figure out a way for all of the colleges to collaborate so that if Western Kentucky has empty seats, UK is full, and they're turning away people, there needs to be a way that we can communicate to these students that they're where the open seats are. And I mean, that's not something that the Board of Nursing has done in the past, but I think it's something that we're going to have to work on a program and work on a way to better utilize. And you're right, to keep these students in Kentucky versus going somewhere else. So very good point.
Our next question is from Rose McBride. Why are more nurses interested in travel nursing right now? Is the number of travel nurses coming to Kentucky balancing out the number who leave to travel? I'd like to start on an answer for that, and then I would like to pass that off to Kristin. I have to say that I hear about nurses who are being offered these incredible bonuses as well as very high hourly fees. I mean, when you're talking about a nurse who has a student loan to pay off, it's very attractive to them. And so and they're not being treated well at work by patients and families and sometimes colleagues. So they're balancing this. Do I pay off my student loans? And do I go to an environment that might be more pleasant? Because I have to change my scrubs before I go to the grocery store because I get accosted at the grocery store. And so it's a difficult decision for many of them, but they make the decision to leave. The other thing that I think is really important for people to realize is that in the projections, it doesn't show that Kentucky has a major shortage of nurses. And so we have states like New York, Texas, surrounding states, as well as California, who are coming to get our nurses. They're poaching Kentucky nurses. They look like, Kentucky has plenty. Well, let's just go there and get those nurses. And so they make it very attractive. So we have to do our part to retain those nurses, to get them to stay local and work local. Kristin, I'm going to pass it off to you.
Sure, and you hit it right on the nail on the head, Dolores. I mean, it's very lucrative to travel. Organizations have been paying recently over $200 per hour for a travel nurse. I mentioned that, organizations are trying to figure out how are we going to account for, this drastic increase in salary and wages for our staff, but that's what the market is demanding, and that's what nurses are making. So you've got a new grad that may come out making, $27 an hour, and we have travel organizations that are taking nurses with very little experience, and you go from making $27 an hour to probably not the $200 that we're paying these agencies, but a lot. It's very hard to pass up when people have student loans and other financial responsibilities. So it's up to us and as leaders to help cultivate and create that environment and culture that we have our nurses not want to leave. And that's been very hard for us to fight that the providing for my family, this is the best thing for me, to the I want to stay here because I love this organization, and I believe in the mission, and I love what I do here. I love Louisville. So that's been a real big thing for leaders to try to figure out how to get over. So it is. We are seeing travel nurses from other areas into the at least the Louisville area. We are getting some from out of state, but what we're seeing in the Louisville region is we have local travelers that maybe a nurse worked at another system and lives in Louisville, but still will come and work at another healthcare system and make travel nurse rates. So we are seeing kind of inter-region nurse travel, and then we are experiencing some coming from other states to take these lucrative contracts.
Thank you, Kristin. I have to have a shout out to Dr. Ernest Grant. He is the president of the American Nurses Association, our national partner, and we're always honored when he takes time to come and be with us. He's actually an honorary KNA member. So thank you, Dr. Grant, for being with us today. And so he has a comment. He says he applauds KNA and the KBN and others for shining the light on the crisis that is not only affecting Kentucky, but the nation as a whole. And this is the first step in beginning to resolve this issue. My question is, let me see here, Dr. Grant. Question is, calling for the investment into the nursing profession and salary increases, and are there other things that we might do that can be heard from nurses that would keep them at the bedside? So who would like to take that one? Betsy? Kristin? Donna?
Can you repeat the question again, please?
The question has to do, are there other things that we can do besides the financial support to keep nurses at the bedside? And I think you touched on a few things in your comments.
Yes, I believe, I think there needs to be, I applaud our nurse leaders in this situation because it's a very difficult time for them. Many of them are in staffing. They're continuing to do the jobs they normally do, administering payroll, all the things that they normally do as a nurse leader, working with the physicians, et cetera. But now they're also having to work as staffing. However, I do think, I think KONL is a great example of an organization that tries to promote healthy work environment, good communication. There are many things we can do to improve the voice of the staff nurse. Some organizations are blessed to have a very formal, wonderful shared governance program, for example, where staff nurses participate in councils and are heavily involved in the decision-making that affects the patient care. Other organizations don't have such a structured format, but you can start as simply as, at a morning safety briefing. Hey, this is what we need to do. Do you all have ideas about how we can do this? Or, we're short a person here. What are your all's ideas about how we can manage this as a team? But many of our hospital organizations, and I'm sure other organizations also, have programs in place to try to improve teamwork, communication, patient safety along the way. So I think there are many things that we can do that are not financial that we need to make sure we implement and work hard on. It's, again, even more difficult. Everything seems to be even more difficult in the situation of a pandemic where you have already maybe had staffing shortages, and now those are significantly changed. So I don't know if any of the other members have anything to add to that, but.
Donna, I agree with everything that you said. I mean, it's the battle that we fight every day within the hospitals is, creating that culture and environment to where nurses want to practice in. So, do we have the right leaders in place? Are we taking care of our employees, beyond the financial means with, feeling part of the community, feeling part of the unit? So it's tough to fight that salary battle when it comes to the nurse wanting to take care of their own family and financially. So it is a battle, and we have to think of very strategic and out of the box things to retain our nurses right now.
Thank you. And there's another couple of comments in the comments and questions in the chat box. Lawrence Smith asked, where would the money come for these proposed solutions? We understand that there is quite a bit of money coming to the state through the legislature to improve the healthcare workforce shortage. And my understanding is that's about $400 million. So that is really where we are looking at this. And there's another question about how would we actually implement administering this, and we would collaborate with other organizations, but Kentucky Nurses Association would be happy to be the leader in administering this and helping create task force to implement the different programs that we have listed in our recommendations.
I think it's also important to note that because the Kentucky Nurses Association is the organization that represents every nurse in the state, no matter where they work and what they do, we are positioned to provide that support and collaboration for every single nurse in the state. So we have a couple more questions here. How might you recommend nursing organizations, employers, legislators use the findings outlined in this research? Donna, would you take that one on for me?
I would believe that we will follow up with this, with the press release, with a news release. We've put together a task force that you've heard from today, and we plan to continue meeting. This problem, again, we know it's not new, but it is at a high crisis level. So we will continue to try to meet and be an action committee to actually identify steps that can be done and work with, possibly through the Kentucky Hospital Association. Obviously, that is the organization for the hospitals, but we know this is not limited to the hospitals. We have with us two different long-term care organizations. Long-term care, as we've noted many times, has been hit very hard. We would also work with them to make sure that they are well communicated with about plans to move forward. Same thing with academia, with the colleges of nursing throughout the state. Kelly at KBN has been an excellent partner with us, and we believe that there could be a wonderful collaboration again with them, with the colleges of nursing throughout the state to really improve use of students, getting more students in those seats at the schools, improving clinical opportunities for people. So I believe that is kind of how we would work with our partners among the healthcare organizations. And I've kind of not spoken much about the Department for Public Health, but our local health departments also. They're another organization that have a strong nursing workforce who have been out there in the trenches for 20 months now, trying to make sure people get tested, moving from just testing. And again, many in my local health department has had to put on the back burner many of the things that they normally do in order to deal with the COVID pandemic. So they were very, very busy testing. Once the vaccines came out, we've been very, very busy trying to do vaccination clinics. We've been testing and vaccination. KNA is doing vaccination and testing clinics throughout the Louisville metro area. So does that kind of answer that question?
Thank you. We also have a question for Dr. Grant, and I know that you're really a KNA supporter, so here you go. The question wants Debbie Yetter from the Courier Journal wants to know, how do we fare in terms of the nursing shortage compared to other states?
Thank you for the opportunity to contribute. And as Delano mentioned, I do consider myself an honorary member of KNA. You guys are absolutely awesome there, and keep up the good work. I think Kentucky is one of those states that I would consider to be on the verge of, if not already at a crisis, very close to a crisis. As was mentioned, other states are coming to Kentucky, and states like Kentucky, and are pinching off their nurses. They can offer them very high salaries I mean, literally all what the nurse has to do is pretty much pocket their paycheck, because they will also pay room and board, give them a food stipend and, everything like this. So it, makes it impossible to say, no, I'm going to stay here in Kentucky rather than travel to the Midwest or the West Coast. The downside to that, unfortunately, is that healthcare in the state of Kentucky will suffer. The consumer is going to lose out, because the healthcare that they have come to know and love or come to expect is not going to be there, due to the fact that the nurses who do remain are going to be totally exhausted from having, worked so much. We know that working more than 12 hours is physically and mentally exhausting. And we already know that when you quote unquote are working 12 hours, that 12 hours is already 13 or 14 hours. So you get home and you have maybe, about perhaps 6 hours of sleep before you have to turn around and come back into work. And that is not inducive for a very good, safe working environment as well. The nurse needs to be able to take care of him or herself first. Have that resiliency and be in order to be prepared to provide patient care also. So I hope that answers the question, and thank you for the opportunity to speak. And I totally applaud KNA and all the other organizations that are at this news conference today for the efforts that they're doing. This is I tuned in because we're going to be starting a series of listening sessions around the country from the American Nurses Association. So this I've been taking notes, and we'll see what is going on. If what's going on in Kentucky, also mirrors what's going on in the other parts of the country. So thank you.
Thank you, Dr. Grant. I have a comment here from Lisa Lockhart. I worry for long-term care, critical access hospitals, and other small organizations that cannot sustain the incredible increased cost of the travel paid for nurses. I fear that some will be forced to close their doors in large rural state, and that could be devastating to our community and public health. I have another comment here from Ruth Carrico, our immediate past president for the Kentucky Nurses Association. I believe that we can also address concerns regarding workplace safety and worker safety in the area of infection prevention and control, ensuring that we have standardized and evidence-based training and competence development approaches, addressing and removing the concerns regarding the application and implementation of care, infection prevention, and control practices so workers feel safe and are safe. I have another question or comment from Brittany Welch, Dr. Brittany Welch. How can we assist in increasing the talent pipeline in order to ensure increasing nursing students? Who'd like to take that one on? Betsy, you have any ideas about increasing that talent pipeline?
Sure. So one of the things we've been working on, and I know our setting is not like a hospital setting, but we are very dependent on, as I said earlier, state registered nurse aides. So one thing we've been looking at is really getting into the high schools, and for those students who are not interested in going right to a community college or a four-year college, to get them certified as a state registered nurse aide, because that truly is a career path. And this goes back to some of the other things that people were saying about, keeping people close to home, keeping them part of the family life of their employer, and not having them be tempted to go out of state, but making them sure they feel like they belong. So you can become certified as a state registered nurse aide right out of high school, and you can start working in long-term care setting and other settings as well. You can have benefits and pay, and then you have a career path. And just like the KNA and the KBN, we have a foundation in our association as well. We provide scholarships, and we have seen tons of state registered nurse aides get their LPNs or RNs, become directors of nursing, go into corporate compliance. And it truly is a career path, and we recognize them every year at our annual meetings. Some people have been in long-term care for over 30 years. They started out as a state registered nurse aide. So I think that's the key, to target our high school students, get them interested in the field of healthcare first. And you know, not everybody's right or ready to go to college right out of high school, but get them interested, get them the skills that they need to start. And then hopefully we will keep them forever, and they will be, you know, valuable nurses that are taking care of the most vulnerable populations in Kentucky.
Thanks, Betsy.
Thank you, Betsy.
And many of our high schools have certified nursing aid programs where they can actually become a CNA in high school. And then some of our communities have pipelines where then that gets them a foot into an LPN program, which then gets them a foot into an associate degree nursing program. So there are processes for a pipeline for those people who are not able to graduate high school and go right into a BSN program, for example. And I think Carlos wanted to speak about, he is one of our members of the Kentucky Nurses Action Coalition. I think Carlos wanted to speak to the pipeline also.
I would like to say, in regards to pipeline initiatives and the programs I work with, which are the regional area health education centers, you know, we have 8 centers across the state. All of them run pipeline initiative programs. And we really have been working hard to increase our presence with the nursing programs in their regions. And I say that because almost all of them have some sort of summer program or some pipeline initiatives. Right now, we are currently running the AHEC Scholars through a federal grant, which actually provides incentives for students to participate. And so again, when contacted by a regional office for participating in a summer program or a summer camp, I would not only encourage, I would be very appreciative if programs responded with willingness to come and talk to students, because that's actually been a little bit of a challenge. You know, as you know, in the last 18 months, we've not been able to meet face to face, but we've been doing a number of Zoom meetings. Right now, we have 90 plus group called Health Investigators. I'm sorry, I'm stumbling with the name, Health Investigators Group, which is 90 plus students from across the state that are interested in health professions. And I know we have a nursing program that's going to be presented, but I think it would be beneficial to the group if we could get somebody from a state office or a national group to talk to these individuals, because I can say from the pipeline programs that we run at UK, the Summer Enrichment and the Health Researchers Youth Academy, one of the largest outcomes is that our students end up going into nursing. So there's a tremendous interest in it, not only from our students, but also from the regional centers. So if anything we can do to help in the pipeline initiatives, please don't hesitate to reach out to me, and I'll put you in contact with regional centers or other partners that we have in the state. Thank you.
Thank you, Carlos. Also, there is a question, how do we keep nurses from looking out for positions outside of Kentucky? First, I would just like to make a comment, and that is the nurses don't have to look. People are coming to Kentucky looking for our nurses. So some of the things that we can do that are in this recommendation has to do with a major campaign to show nurses gratitude and appreciation. I think Donna talked about what we did at the beginning of the pandemic, and Kristin also talked about how we saw nurses as heroes, as people who came and did the work and they stayed. And even when people were dying and family members were in turmoil, they were still there. But now nurses have to change out of their scrubs to go to the grocery store. So we need to do a major campaign to help nurses to feel the gratitude that we should be feeling towards them. And Donna has an idea about PSAs. Donna, you want to share with that?
Yes, I actually reached out to Dr. Grant the other day, or Delano and I did, about a national campaign. My vision would be a national PSA type thing where that would be seen. Monday Night Football on a commercial or something like that to stress the importance of nurses and recognize nurses, and to make sure that everybody who pops open their TV gets that message that we're being underappreciated, and you've got to have us, and that please show your gratitude for these people who are serving our country right now in a very difficult, very, very difficult situation. And back to the question about how can we keep nurses from looking outside the Commonwealth for nursing jobs. I know you addressed that they're not necessarily looking, they're being sought after, but that's really where our financial recommendations come in. We want to provide loan forgiveness. We don't want that 26-year-old nurse who has a few years of experience now and is being recruited by a travel nurse agency, but has maybe $30,000 of student loan debt, to say, well, you know what, if I take this 13-week contract in Missouri, I get a bonus of $50,000. There goes my loan. I'm done, and I'm back home in a little bit more than a quarter, a little bit more than 3 months. So that is one thing. I think loan forgiveness is huge. Another thing is the recruitment and retention, a plan for bonuses for that. And again, hospitals are doing the best they can to incentivize and pay additional than they normally would. But we really need to cover all of the nurses who are working diligently in Kentucky to take care of our patient load. So those folks who are serving our state and are not leaving, we want to provide them some type of a financial reward. And obviously there would be some structure to that, which has not been completely, it's been discussed, but it hasn't been obviously finalized. But we have definitely put some thought into how we would make that happen.
I have another comment here from Judy Gotzi. Very happy that KNA's plan includes attention to communicating a consistent and positive image of nursing. This has an incredible application for recruiting the next generation of nurses. Also, there's a comment here. This is from Debbie Yetter from the CJ. How significant a problem is the physical or verbal abuse from patients and families? And can you describe any situation in which that has occurred? Kristin, I'm going to let you take that one. And then Betsy, if you would discuss for us. And then I of course, have some comments as well. Kristin?
For sure. And, as I mentioned, nurses went from heroes to being blamed for things. We've had experiences where we've had patient family members lash out. A lot of this has to do, too, with our visitation lockdown that we had to do. I know it was very frustrating for patient family members and for patients to not be able to see their loved ones, and our mask, universal masking that we have, and visitors have to put on a mask. That's been a battle. Visitors coming into hospitals not wanting to do that, but it is very scary from the nursing perspective on having to worry about protecting themselves. At our organization, we actually sent some of our key leaders, like our assistant nurse managers and other staff, particularly in the ER, to additional training on safe crisis management, on how to protect themselves if they do have a patient or visitor they need to do that with. So we've really had to look at safety in this whole scheme of things to make sure we're providing our staff with that additional education and support so they feel more comfortable in their work environment.
And one of our organizations actually issued panic buttons to all of their nursing staff, so that when a crisis occurred like that, they could immediately get the attention that they needed, which is just almost unbelievable, but unfortunately it is happening.
Betsy?
And I agree with everything Kristin said. So, unfortunately, a lot of our nurses and direct care staff were blamed because of the lockdown, and they were just doing what they were required to do, for one thing. but it was intended to keep our elders safe in the skilled nursing facilities, and they were blamed. And I understand that the last 18 months has been stressful for all of us, especially family members who were unable to see their loved ones in long-term care facilities. But unfortunately, that anger and stress was taken out on our direct care workers when they were dealing with their own struggles. Our nurses in our skilled nursing facilities had to step in and become the family for those elders because they were not able to see their loved ones. So they were, having to provide emotional support that maybe that went above and beyond what they typically did on a normal workday. So it was unfortunate to see. And again, I think Kristin was the one who said they were healthcare heroes in the beginning, and then all of a sudden they were demonized in the end. And we need to turn that around. And I think a PR campaign is much needed, and we will support that wholeheartedly.
Thank you, Betsy.
All right. Well, we are a little bit over time. I really appreciate everyone joining us this morning. I hope this has been helpful to illuminate the situation, the current situation, and get everyone's ideas rolling about ways that we can work together to improve the situation. I want to thank today's speakers and the Kentucky Nurses Association Education and Research Cabinet for developing our nurse survey. We also sincerely thank all Kentucky nurses for their service to each other and to those in their care. We'll send out a follow-up news release later on today, and please contact Delanor or myself if you have any additional questions. Thank you very much.
Thank you all.